I think one of the things that we have to remember is that COVID is still out there. And we mustn't drop our guard. I think a lot of us have. I think we probably wash our hands less and use the sanitizing gel less. We hug and kiss more. We go to crowded areas, and perhaps we should be wearing a mask even if we're not required to do so. And certainly we should wear a mask where we are required to do so, like in shops, for example. So I think the measures are really for us to impose upon ourselves. Clearly we are looking at what we do with large events. We saw last week's announcement of the cancellation, sadly, of the fair and of Saturday Night Live. We are talking to private event organizers about requiring on-the-day test, vaccination, and possibly, depending on how it goes, that they shouldn't proceed. So these are relatively small measures but can have a significant effect. The positive thing is, of course, that we are seeing no pressure, virtually, very little pressure in the hospital, that the vaccination we are seeing does protect us from serious illness and reduces our infectivity if we have got COVID. But there are still unvaccinated people through choice or necessity or because they're younger. So we still have to be aware, and we still have to use the precautions that we've learned from over a year and a half ago.
It's a very different context to what we had a year and a half ago when we first went into lockdown. I assume the triggers aren't the same that would require measures by the government to be imposed. Are there criteria that you're looking at that you say, well, if we hit so many cases, we will have to act?
Well, at the moment, as you say, the situation is very different. We can't exclude any possibility because we don't know how it's going to go. But we are not looking at a scenario that we were months ago, where we had serious illness, we had people in intensive care, and sadly, we had deaths. At the moment, UK is predicting an increase in deaths. That to us would translate probably 1 every 8 days, which is far too many, but clearly it's not what we saw in the early spring. And therefore the triggers are different because we have large vaccination and we are more ready than we were. So I think we are cautious. It's a wait and see situation, but not just wait and see what happens. We are there. We met yesterday in our strategic group chaired by my friend and colleague, the Minister for Health, which I also attend, and we are there, we are monitoring, following advice, and if we have to step up, we will. At the moment, as you say, it's a very different scenario to what sadly we saw at the beginning of the year.
And it seems obvious, but a majority of new cases are in vaccinated people. Some people may feel like there's no point getting the vaccine because we're still going to get COVID, so what would you say to them?
Not at all. About 50% of people currently with COVID are unvaccinated, whereas we have perhaps 80% or more people vaccinated. So the percentage itself shows that vaccination does give you a significant protection from the infection, but it also reduces the seriousness of the illness and your infectivity. So therefore, absolutely, vaccination is the right thing, and the stats actually prove it. Remember that if you're saying a vaccine is 90-95% effective, that's still 5 or 10 people in every 100 who could be prone to getting it, although probably at a lower intensity, so absolutely worthwhile.
And when you say that we have to be sensible ourselves and be sensible in the face of COVID, are you not anticipating that the government should impose any measures, and do we have to balance the COVID safety against keeping Gibraltar attractive to tourists perhaps?
I think what the government has always done is the health of the people first, and this will always be the government's first priority. At the moment, it's not a question of a balancing act, because as I have said, vaccination gives us a level of protection against the disease and against serious disease. All options have to remain open. There could be a variant which sadly, tragically, could be much worse, much more virulent, perhaps which evades the vaccine. We are not there now. We are in a situation in which we have to be aware and alert, but nowhere near where we were at the beginning of the year.